Great, thank you so much for the introduction. Thank you all for joining. I'm delighted to be here and to see this great panel we have. I was asked to give a few framing remarks before we start, and I was thinking one way to frame it might be to describe at least a set of the major challenges that certainly I'm conscious of, but I think many people are worrying about around impact evaluation. These are challenges that I think many of the presentations we're going to see today address in various kinds of ways. The first of those challenges is the challenge of getting a richer array of data into discussions or information into discussions about impact evaluation. A lot of classic impact evaluation is quite thin in the data that it uses, treatments and outcomes and so on. But what we'll see here today is efforts to broaden the set of data that's used, whether it's to use big data in various ways, to use historical data in various ways, to think about using official data in various ways, and also to use information such as the views and perspectives of program designers and participants as data that's relevant to understanding impact. And a real challenge with bringing this wide array of data to bear is bringing it all together, making it all add up to something. So that's one challenge that I see as a perennial challenge we have. A second challenge we have is, I think, extending inferential approaches. So there's been a lot of interest there's been a big growth in various sorts of quantitative and experimental approaches, but a real continued interest to make a good use of qualitative research. And these methods often use different sorts of inferential approaches. And it's often a challenging feature that these two types of inferential analysis are not brought together. And that's one challenge we often have. How do you get a kind of a single conclusion from very different sorts of inferential strategies that people can use? A third challenge that I think will come up today is complexity. The classic impact evaluation design imagines that you've got a very simple, it's almost based on a trial for medicine. We've got a very simple treatment and you've got a very simple outcome, and you look at those two things. But in fact, we're very often looking at situations where the interventions themselves are very complex. They've got very many components, and the outcomes themselves are also very complex. And there's a challenge: how do we address the complexity and figure out what parts are doing the work, through what mechanisms are they operating, and so on. I think this is a theme that will come up in a few of the presentations today. The fourth challenge is aggregating and generalizing. So I think one question I think one thing I think most people believe is that context matters, but it's a frustrating thing to leave it there to say context matters, so we're not willing to make claims beyond our context. And the challenge is to think through: can we grapple with the question of context mattering in order to be able to say under what conditions do we think findings we have generalize, or under what conditions can the findings from my study be informative for the findings of your study, and so on. And the last theme I want to touch on, because I think it's picked up in a few of the presentations today, it's not talked about as much, but I think there's a very serious and important concern about who owns research and who participates in research. There's been a tendency in many places for impact evaluation to be seen as a technical activity taken from the outside. Sometimes it's a kind of an auditing type of activity. But I think we'll see presentations today that foreground the role of participants, both those taking part in programs and those designing programs, to learn about the questions they have and learn from them about how best to understand, interpret, analyze patterns we're seeing. These are all big challenges. I think the classic impact evaluation fails on all of these, or many of these, and the papers we're looking at today will be addressing some of these. So those are just a set of framing remarks. I think now we'll go ahead with the first presentation, which would be Matt Juden from the London School of Hygiene and Tropical Medicine. He's a research fellow there, and he's working on a project close to my heart. I've been working somewhat with Matt on this question as well about combining process information with input output information to understand the impacts of programs. Over to you, Matt.
Okay, great. Thanks so much, McCartan. I will launch straight into it. So we're talking, as McCartan said, about the point approach, process outcome integration with theory. The point team was and is an international collaboration co-led by LSHTM and UKZN, the University of KwaZulu-Natal. We worked with 2 partner teams, some details of which are there on screen. We also explored a 3rd partnership, which got to different stages with different teams, and that afforded us some learning, even if that 3rd partnership never completed. So what is the point approach? What is process outcome integration with theory? What did we actually do? So worth saying, this was an early stage work, exploratory work. What we were doing was working with these partner teams to adapt their theory of change into a formal causal model, depicted as a DAG, a directed acyclic graph, and we'll look at that a bit in a minute, to specify the DAG in R using the causal queries package, which McCartan very heavily involved in, elicit the partner team's beliefs, and that is to say the designers, evaluators, senior implementers of the intervention, elicit their beliefs about the nature and strength of causal links in the causal model, their priors about how this was supposed to work and to what extent, to combine those priors into a single set of shared prior beliefs, then to update this causal model on data alone or on data and the priors to generate posterior models, or on priors alone as well, and then to query the prior and posterior models to learn about estimates of interest and the relative role of prior beliefs and data in the combined analysis. So we'll unpack that a bit as we go through. But first off, what were our objectives with this? So as I say, very exploratory early stage work, trying to adapt and test a promising method from political science to a development context. What we were hoping to do was to formally integrate theory, process, and outcomes data in order to learn as much as we could about all 3 by using all of the information available to us, and then to generate transferable inferences about outcomes and process in a formal, transparent, replicable way. That is to say, current best practice is quite often extremely technical and formalized on the impact side, fairly technical, formal on the process side, but integrating those inferences is done in a less formalized, less formal, less transparent way generally. So we were looking at what the potential advantages could be of using this method to formalize that process. And then what I've also said here is to learn about the balance of causal types, not just aggregate effects. So we'll get into that a little bit more in a minute. But basically, the idea is that this causal queries package that we're using takes a very granular approach to causation. We're looking at all of the different ways in which units might causally respond to the intervention and to features of context. And we're able to kind of disaggregate those positive, negative responses and not just look at the effects on average. Worth saying right up front that the approach, this Bayesian approach using a formal causal model specified at a very granular level is very computationally intensive. And that was a challenge that we managed throughout. We developed the tools a lot in order to overcome that challenge to some extent, but still there were very real computational limits and also just conceptual limits on the complexity of the models that we could treat in this very granular way, which meant that we had to limit the complexity of those models by, for example, limiting ourselves to low-valued nodes. That is to say, all of the elements in our model were mostly binary, and we did some work to extend to ternary or quaternary elements, nodes which could take 3 or 4 values instead of just 2. But we are limited to those lower valued nodes. We also had to limit ourselves to not too many parent nodes for any given child node, which we'll look at in a minute. And we sometimes sought to put restrictions on our model about the directions of causal effects or the extent of interactions in order to simplify models, but that loses some of the advantages of this approach. So what do those 6 steps that I flashed up on screen actually look like in practice? Well, the first one is to take a theory of change and turn it into a DAG. So this, for example, is the Upavan partner team's theory of change. We looked only at one of the arms in their factorial trial, the Agri arm, which is the arm represented on the left of their theory of change. And on the right-hand side of the screen here is the directed acyclic graph or structured causal model, which we managed to get to through a series of workshops and email exchanges with that team to underpin our analysis. Next step was taking the DAG, specifying it in the software R using the package causal queries. So this is, here we have an example of the sort of text used to specify the structure of the model, which also has some restrictions fitted to it. And then the package causal queries generated a formal structured causal model, and also a list of nodal types. It's outside of the scope of these 8 minutes to really talk about what nodal types are in detail, but nodal types are all of the nodal types is all of the ways that any node, any box or circle in this case, in this structured causal model, can respond to all of the different combinations of values taken by its parents. What we then did was to elicit the partner team's beliefs about causation in the model. So on this slide, we've just got a very simple example from our training exercise, which we used with our partner teams when we were eliciting their prior beliefs. It was very challenging to elicit prior beliefs over all of the relationships in our model, because that's a lot of parameters. For the Upavan team, that was 214 parameters. The approach that we came up with was to use contingency tables, like the table towards the bottom of this slide, to elicit from participants point estimates for the proportion of units which would take a given value for a child node, given the different combinations of values that their parent nodes, that the parent nodes of that child node could take, and then to ask participants about a level of certainty in their answers for the table in order to generate a distribution around that point estimate. And here I'm showing the same graph that we showed to participants, although obviously they had a lot more than 15 seconds to absorb it, which communicated to them how we were treating the different levels of certainty that they were giving us and how we were generating distributions around their point estimates using those levels of certainty. We use the point estimate and the level of certainty to generate data which, if observed, would justify the belief that they've told us that they hold. And that gave us data for the team's priors. So what we were then able to do was to update the model on that priors data, also on the data from the trial, and also in a third specification on the priors and the data, in order to generate posterior models for those different model specifications. And so what you're looking at here is for all of the nodal types, for all of the different ways in which nodes in the model can respond to the values of their parents, what is the posterior distribution for the nodal type in those 3 different model specifications? So to unpack that a little bit, this graph labeled A here is the nodal type for the primary outcome, dietary diversity in the case of Upavan. And this is the nodal type which is sometimes referred to as cursed, where no matter what value the parent nodes take, this node is always going to take the value 0. It's always going to be false. So in this case, that means the outcome that we were looking for didn't happen. And these 3 different distributions show us in red what the experts' priors implied, suggesting that this nodal type would be less likely to happen than for the other model specifications. In green, we have what the data alone told us about how often units are expected not to take a true value for the outcome, not to have the outcome that we're looking for, regardless of the values of the parent nodes of the outcome node. And then in blue, we have the combined model, priors and data, showing us somewhere in between in this case. The posterior distribution is a compromise between the priors alone and the data alone, as you would expect. And then B is ways in which this outcome node, the outcome that we are hoping to achieve in this intervention, is causally affected by the values of the parent nodes. We can see from A that our experts, the partner team that we were working with, their priors were that the number of units that wouldn't respond, wouldn't have the outcome we were looking for, regardless of the values of parents, was underestimated compared to the data. And that's reflected in these charts, which have been labeled with B, where the priors overestimated the likelihood of the nodal types which reflected some kind of causal effect compared to the data. We're then able to query the models. So the plots that you just looked at are a useful way of eyeballing what's going on, but we can generate more precise, precisely specified estimates by querying the posterior models. And here what you're looking at is, if you just look in the query column, the query is asking, what is the probability that the outcome, dietary diversity, takes a value that is greater when a unit has been assigned to the intervention, when agri equals 1, compared to the value for the outcome when the unit has been assigned to control, when agri equals 0. If you were to ask that query without any givens, without any conditioning, then that would be a treatment estimate. But here we're able to specify 2 givens. They are that indeed agri equals 1, the unit was assigned to the intervention, and also dietary diversity equals 1, the unit did get the outcome that we were looking for. So in this case, what we're asking is an attribution question. We're asking, what is the probability that the outcome that we were hoping for, that this intervention was supposed to bring about, what is the probability that that was actually due to the action of the intervention? And in this case, the point estimate is 0.11, probability of 11%. And then we can add more givens to this query in order to, in this case, explore the role of moderation by having a non-monsoon water supply. So here we can see that when we have the given, the non-monsoon water supply is 0, that increases our confidence that a change in the outcome was due to the intervention. We get a probability of 0.14. Whereas when we know that a non-monsoon water supply is present, that decreases our certainty, our confidence that the intervention was responsible for the change in outcomes. And I apologize that this is a whistle-stop tour. I would encourage people to really look for our papers when they come out, and to look for our academic report when that's up on the CEDIL website, because this is quite complicated stuff. Very quickly then, in terms of implications for evidence relevance, as we were asked for, our experience was that this DAG process, this process of converting the theory of change into a structured causal model, was very useful for our partner teams. That the lack of ambiguity in the DAG led to evaluable theories and forced hard questions. That the granular approach, really identifying all of the nodes and separating them from each other, identified more relevant third variables, confounders, moderators, mediators, which could guide design and improve transferability. That a lot of data was collected that probably didn't need to be, and also some data wasn't collected that did need to be, and that was made clear by specifying all and only the nodes that were necessary on the DAG. And that it was possible to elicit prior beliefs over a complex model, a model as complex as the Upavan intervention, which we feel strongly could lead to better design of interventions and could lead to more precise, more credible, more transparent combined inferences, especially in the face of unexpected results. If you have an explicit causal model of your prior beliefs and you're able to say transparently how they're updated with the data, then that's a powerful process for integrating especially unexpected insights.
Matt, I think we should leave it there because we're quite over time, if that's all right.
Apologies. Well, there we are. That's the end of that. I did my best.
Thank you so much. Then our next presentation is a team presentation by Claudia Ringler and Nazmun Ratna. Claudia is the Deputy Director of Environment and Production Technology Division at IFPRI, and Claudia is a development economist at Lincoln. And I'm going to hand over right away to you for your presentation on complex interventions.
Thank you very much, McCartan, for the kind introduction. So, and I will work together with Nazmun to give you some insights on a couple of innovations on our migration evaluation project titled the Gender Sensitive Risks and Option Assessment for Decision Making to support the Work in Freedom Phase 2 program, which is a bit of a complex title. It was a collaboration of IFPRI with American University of Beirut, Australian National University, Dhaka University, and Lincoln University. The Work in Freedom Phase 2 project that we were evaluating was implemented by the International Labour Organization and focused on reducing women's vulnerability to trafficking and forced labor in South Asian countries of origin and in selected destination countries such as Jordan, Lebanon, and some Gulf countries. The Work in Freedom program uses a so-called integrated and targeted approach to address multiple facets of forced labor. And the key cumulative impact indicator of the program is that at least 240,000 women have an increased knowledge and or skills. Within this broad goal, the CEDIL migration evaluation project focuses on how are female migrants' opinions shaped by gender and what is the potential of empowerment interventions to reduce trafficking and forced labor. And we ourselves worked in Bangladesh and Nepal as countries of origin and Jordan and Lebanon as destination countries. And Nazmun and myself will go over 4 innovations that we developed and used as part of this project. The first is a net map type analysis where we looked at actors involved in migration. And I see some linkages to the prior presentation as well as in our second innovation, which was the development of causal risk diagrams. Again, I think similar to what we just heard. Our third innovation was the development of a Women's Empowerment and Migration Index to support program interventions, but also to really identify areas of disempowerment. And our final innovation was the training of women migrant domestic workers as researchers, and not just to collect data, but also to analyze data themselves. The risks and options assessment for decision-making framework is just shown quickly here on this slide. It's a causal systems approach to support decision-making under uncertainty and provides a broad analytical frame for assessing factors that affect women migrants' vulnerabilities, but it can be really used in pretty much any context. Application of this framework, so that was really our guiding framework for the entire evaluation. It included the identification of migration actors that covered countries of origin, but also destination countries, so together as part of step 1 or scope that you can see here on the screen. And we also implemented additionally 4 of these national risks and option frameworks through facilitated workshops. Because of COVID, of course, most of them had to be done virtually, but we were able to do it face-to-face in Lebanon. And this really helped us to better analyze and understand the activities that the ILO project had been working on. So here in this slide, I'll talk a little bit about the NetMap approach, and you can actually see on the right the results of the face-to-face NetMap workshop in Lebanon. So those are all of the actors, linkages across actors, and also some power towers or influence that these actors were wielding. So NetMap is a facilitation technique that helps people understand, visualize, discuss, and improve situations in which many different actors influence the outcomes. And as you can see, we really had a lot of actors in Lebanon. By creating these network maps, we basically can better understand who is really truly influential, which kind of linkages make a difference, and also which actors do we want to influence if we want to make a difference in vulnerabilities of women migrants. And one of the papers that we wrote based on these actor networks, comparative analysis of the Bangladesh and Nepal migration network showed that the Bangladesh network is dominated by government actors, whereas Nepal's network includes strong government and non-government entities. So despite the federalism in Nepal, the country's migration network actually turned out to be more efficient because it takes fewer links to reach distant actors, and there are overall denser connections between the various migration actors. Here on the right, you see another graph. Also, the linkages are somehow not very strong. And what it helped us identify are 8 actors that connect migrants across all of the 4 countries, 2 countries of origin and 2 destination countries. And these 8 linkage actors are the ministries of labor in countries of origin and destination. And then you can see the remaining key actors that are actually connecting between country of origin and destination. And one, I think, a key message that we had coming out from the evaluation is the importance of strengthening linkages between those 2 set of countries, because otherwise there are interventions done in countries of origin that might actually not really be beneficial for migrants in countries of destination. Again, actions in countries of destination that actually might, make things more difficult when migrants return. So it's really important to focus on those 8 core actors. And I will now hand over to Nazmun Ratna, who is going to focus on our second innovation, the risk and option assessment for decision-making process. Nazmun, over to you.
Thank you, Claudia. Can you hear me clearly?
Yes.
Yeah, thank you. So I'm going to discuss the findings of step 1, which involves a foresight exercise with various stakeholders to develop a causal risk model. As Claudia has said, that ideally we would have the returning potential migrants in those workshops, but COVID-19 forced us to have the online workshop. And we tried to address this limitation by reaching out to maximum number of NGO workers who had direct contacts with the women migrant workers in Bangladesh and Nepal. Acknowledging that the stakeholders' objectives and function often overlap in the migration system, we attempted to derive separate causal models by dividing the stakeholders into various groups. For example, in Bangladesh, we had 3 groups. One was policy and advocacy, the other was NGOs and international NGOs, and the third group was researchers. First phase, Claudia, next slide, please. First phase was for each participant to identify triggers for the defined risk given. So given the objective of our intervention, we defined the risk, and then we asked the participant to identify the triggers. And after the triggers, they identify the drivers, which causes the triggers, followed by the negative consequences of the risk given. Then as a group, they decide on causal linkages among these 3. And I discussed the triggers and drivers in the next 2 slides for Bangladesh and Nepal, and then Lebanon and Jordan. In the second phase of this step, the participants were asked to identify the controls and mitigants, followed by the identification of the causal pathways through a facilitated discussion. So I think it would be better if I give an example. If Claudia, you can go to the next slide. So here, this is an example from it's a simpler version of the causal model that we developed with the policymakers in Bangladesh Road workshop, where I'm just identifying the controls here. So following the process described above, the participant first identified the trigger, for example, influence of intermediaries or dalals, as we say in Bangla, causing trafficking and forced labor of women migrant workers. And then participants identify asymmetric information about the migration process as the driver. And then in the next phase, like I said, they identify, suppose, for example, control 5, which they define as accountability of recruitment intermediaries as a both pre-trigger and post-trigger control, among other post-trigger controls like C6, which is the regulation of migration channels, by publishing the list of accredited intermediaries. Next slide, please, Claudia. So in this slide, we are presenting some of the results that we found talking to the stakeholders by identifying drivers and triggers in Bangladesh and Nepal. One clarification to make, although I divide the triggers into two categories, there are overlaps between economic and social triggers. So some of the key points to note: the first, learning we have, identifying drivers and triggers is not always clear, which is not surprising in a way, and something we need to think about as we revise the road process for future studies. For example, violence against women is identified as a trigger in the Nepal workshop, but as a driver in the Bangladesh workshop. Important is, in both countries, we see that women, especially single women, see migration as a way to escape domestic violence and the discrimination they face. In our study, we interpreted drivers as a set of deep determinants or structural determinants, and triggers as immediate cause or proximate determinants of the risk event, which are likely to happen at the household level. And again, acknowledging that there would be overlaps. Number two findings, which is not really surprising, that irrespective of the groups, the stakeholders in Bangladesh identified climate variability as one of the most dominant drivers of economic vulnerability, as shown in the causal model above. And in case of Nepal, they also identify 2015 earthquake as their driver for international and even domestic migration. Irrespective of the groups, participants in Bangladesh identified asymmetric information regarding proper migration process as a driver, which actually strengthens the influence of the middleman. The participants identified, for lack of one, formal education, and two, access to information among the potential women migrant workers as a reason for economic exploitation by the middleman. In case of Nepal, they identify no access to get information due to the lack of social capital has been identified as a social trigger. So all groups identify aspiration for better life or shortcut to build wealth quickly as one of the most dominant economic triggers, as is reflected in the academic literature as a pull factor. This is linked with drivers like lack of economic opportunities and is also overlapped with other triggers like poverty in the global south. Although the narrative for push factors of international migration has been economic, we identify through these participatory workshops that social factors related to women's agency and like lack of recognition of their work and lack of decision-making power is one of the main reasons women wanted to migrate. And this gives us the basis for developing the Women Empowerment in Migration Index. In the next slide, please, we talk about the findings in Lebanon and Jordan foresight workshop. And I would like to make 3 quick points. I know that we're running out of time. Number one, commonalities with countries of origin. Lack of employment opportunities in the country of origin has been identified as a policy trigger, and gender-based violence as a social trigger was only identified in Lebanon. In terms of economic triggers, the contrast between the findings from the 2 workshops are more pronounced, following the 2 different trajectories drawn from drivers. Participants in Lebanon workshop emphasize how the Beirut blast and COVID-19 restrictions have contributed to unsafe migration and trafficking of women migrant workers. Participants in the Jordan workshop, on the other hand, mainly focus on pull factors, aligning with the aspiration for better life and children's education, which were identified in the countries of origin as well, as we have seen. Number 3, significant difference can be drawn for institutional and policy drivers. So, for example, the participants in Lebanon focused on lack of participatory governance and marginalization of women migrant workers because of kafala system, absence of translated contracts, and multiple contracts with varied terms. The participants in Jordan, in contrast, focus more on pull factors for women migrant workers. It is important to note that the existing bilateral agreements between countries of origin and Jordan facilitate a relatively safe migration, especially for ready-made garments workers for Bangladesh. So it was not really that surprising for us. Next slide, Claudia. In this slide, we present the set of the most preferred controls and mitigants. So once they have identified the control and mitigants, the group come together and then they're given an option to choose the 2 most preferred options. And as we can see that, one of the main findings from the Lebanon workshop was dismantling the kafala system, and inclusion of domestic workers under the labor law is identified both as the most preferred control and mitigant. Then improved wages, better working conditions through bilateral cooperation for women workers, both in the country of origin and destination country, as has been identified as a control in both workshops. So clearly there is, we do find similar results. And then legalizing freelance work is seen as a mitigant, and Claudia will cover this as part of the innovative method we have. And the number 4 that is important, and that leads me to the discussion on the next innovation we have done with women empowerment, is skill development of women migrant workers was identified both as control and mitigant in Bangladesh workshop. So
Nazmun, I'm very sorry. We need to be wrapping up, if you can, in the next minute or so.
Okay, I don't think I can do that, but I will go straight to Wemi. So Claudia, if you can go straight to the slide where we have the, yes, so this is the Women Empowerment Index that we developed, where we adapted the ProWea methodology to develop this index. And what I want to focus on this is we adapted some of the original dimensions that ProWea has in the context of migration, and we added some new dimensions. So when we look at the results, if you go to the next slide, Claudia, that would be good. As we can see in the next slide that on average, the WEMI score for migrant women is 0.60, and with only 14% are achieving a score which is higher than the 0.75 cutoff. That's how we're defining empowerment. And among the women who were classified as disempowered, the average adequacy score was 0.53. When we go to the next slide, where we divide them up to see the source of disempowerment, we can see that the largest source was lack of group membership, and that highlights the importance for different kinds of social networks that women can gather information from. And then the next one is restricted mobility in the destination country and lack of asset ownership. Finally, we did test the association between WEMI and some of the indicators for subjective well-being, and we do see a positive relationship. So more empowered women where do have better mental health aspects and subjective well-being. I am trying my best to finish it within time. I'll give it to Claudia.
Thank you.
Yeah, so just to conclude, we had a fourth innovation that I will not delve into, but basically we recruited migrants, women migrants who were freelancers as researchers, as co-researchers themselves, and not just to collect data from other migrant researchers, but also to analyze the data. And so basically the idea is, it's a comparative analysis between how migrants analyze data and researchers analyze data. And just to conclude, what do we think this kind of innovations achieved that traditional evaluation techniques wouldn't have achieved? I think one thing is that we were able to get a much broader set of triggers and drivers. And obviously during the COVID-19 pandemic, I think that was particularly relevant. We also basically were able to use this some econometric analysis around the migration actor networks to elevate the focus on poor policies and poor processes, policy processes. The quantification of women's empowerment through the WEMI that Nazmun just shared basically yielded complementary insights to what is generally mostly qualitative research in this field, and really allows to focus on sources of disempowerment. And of course, elevating migrants as researchers help to really elevate their own voices, and they're generally not heard in what's going on out there in the literature. And then I guess for the second area, how can we, how can we make these, how can these methods, help elevate insights with donors and so forth? Basically, we had some of these decision makers in the room during the road and NetMap exercises. And ILO specifically was actually looking for broader factors affecting vulnerability. And again, quantified evidence helps to monitor changes over time. And then how can we bring, I guess, everyone into uptaking these new methods? And I guess the event today is maybe one of the entry points, including PhD students, etc. It's another avenue. And with that, I guess I'll hand over to our fourth presenter. Thank you very much.
Great. Thank you so much. There was a request by Molly Hagebeck if we can do a very quick summaries, sort of 1 or 2 line summaries of the presentations. I'm going to do that for the first 2, see if I get it right, and then hand over. Douglas, maybe you can make sure you do that at the end of your one. But the 1-line summaries, as I would take it, is from Matt's presentation. The idea is that if you can work to specify your theory of change as a causal model, saying which parts are influencing which other parts, you can then use that causal model to reanalyze the data and ask a set of questions about, for example, causal attribution. Was this due to that? That is difficult to ask with classic experimental data. And maybe one punchline is it's possible, but it's very hard. I think it's the complexity constraints are quite large. If I have to summarize in 1 line, Claudia and Nazmun's presentation, they engaged in a very deep exercise of trying to map out participants' understanding of the problematic that they're facing, figuring out what are the drivers, what are the triggers, and those help them in their analysis, looking at what aspects to look at, and so on, and as well as being empowering and enhancing for the communities in which they're working. That's a very short summary, where there's a lot more going on in those presentations. Douglas, over to you. So Douglas is a health systems specialist working at 3IE. And has worked doing a lot of support for impact evaluation, systematic reviews, and others. And he's going to be presenting on using big data for evaluating development outcomes. Douglas.
Thank you so much for the invitation. Can you confirm that you can see this?
Yes.
Great. Okay. So thank you very much. I just want to confirm, this is a big topic, innovations and impact evaluation. It's a pleasure to join the panel. I appreciate all the work that others have identified and want to acknowledge that the area of big data and artificial intelligence, though gets a lot of hype, is only one aspect of this. And the reason why we're focusing on this particular part of innovative methods and impact evaluation is because it builds on a CEDIL-funded big data systematic map that we did a few years back. I'm presenting here on behalf of some team members, including Fiona Castell and Michael Bamberger, and I'll try to briefly touch on the 4 key session questions here. What are some innovative methods used in impact evaluation? What can they tell us that existing methods can't? What's the difference for policymakers, and how can we promote the uptake of these methods by researchers? Very briefly, I'll only mention about 3IE for those not familiar because it helps frame the presentation. We're an international NGO promoting the production, synthesis, and uptake of use of rigorous evidence, and we strongly emphasize partnerships with other organizations doing this research all around the world in the global south. So how people understand the methodologies and are able to apply them themselves is critically important. The big data systematic map that I mentioned was a stock taking of how big data had been used in impact evaluations in the extant literature that was back in 2020. We searched 17,000 records from our initial screening, got that down to 437 studies, ended up finding that as of 2020, there were 48 impact evaluations using big data, but it was growing rapidly. And there were quite a larger number, 381 measurement studies, sort of indicating that this is a growing area. I expect the number of both is substantially larger now than it was at that time, given this sort of exponential growth that we were observing at that time. The bulk of the data that we were finding, or the papers we were finding, were broken down in, or were in these sort of use of machine generated data. About 70% of the measurement studies, 80% of the impact evaluations are using satellite data, basically, very big use. Also, there were some papers using process-mediated data sources, including administrative data, call detail records, and so forth, and human source data, including social media, crowdsourcing, a little bit smaller. But importantly, we also found challenges in terms of the transparency around the data and methods and ethical considerations, leaving it rather opaque for those who may be interested in trying to apply these methods in their own work. So one of the areas that is important to help demystify is the separation between big data and artificial intelligence. They often go hand in hand, commonly used, hand in hand, but they're often referred to almost interchangeably. I've listed here just some illustrative examples of each that you've probably heard of. And these are by no means comprehensive, nor are they necessarily mutually exclusive. For example, in artificial intelligence, machine learning is integrated into nearly all of the other approaches. And there are also lots of nuances within each of these categories. But motivated in part by the big data systematic map, we've started taking stock of these big data sources and AI approaches in impact evaluation to help bring a basic level of understanding of each of these for development evaluators, particularly given the inherently multidisciplinary nature of the work. I mean, no individual can do all of this on their own, and there's this divide between data scientists and econometricians. And we need to, even those in the evaluation community, need to have an understanding of how to use the language to understand, to communicate effectively with data scientists, to ask the right questions, to make sure we understand clearly what's happening with the data, so we can make sure that it's being processed, analyzed, and interpreted properly. And this is particularly important because different types of big data and AI approaches vary substantially in terms of their use cases, opportunities, benefits, limitations, and their level of maturity as applied to impact evaluations. I'll just give a few examples. If we're looking at social media data, we can apply natural language processing, which can allow us to analyze large volumes of unstructured qualitative data. We can learn about social attitudes and behaviors and so forth. However, this can also be, is substantially biased because the people who are generating the data may be different, often are different in important ways from those who are not generating the data. There's also challenges related to the fact there's lots of noise, extraneous, irrelevant content, fake news, bots, slang, sarcasm, and so forth. In contrast, looking at remote sensing or Earth observation and computer vision, we can estimate variables of interest, whether they're outcomes or covariates, using satellite data. So we could look at crop yields, local economic activity, deforestation, or other variables. And from a bias perspective, satellite data can be particularly useful for impact evaluation because satellites are always on, so to speak, across geographic areas and over time, which makes it possible for us to estimate variables in the same way for an intervention group and a comparison group before, during, and after an intervention. There are also applications of machine learning in impact evaluation that don't require big data at all. So just for example, causal trees and causal forests can help us look at treatment effect heterogeneity on a data set that might come from a randomized control trial, for instance, that drew upon survey data. Another important aspect to consider is that the use cases of these can come at different points in the program or evaluation cycle. For example, and I'll pull from some of the work that we're doing now, this first example sort of spans the data collection, design, and analysis steps. Going back to the sort of computer vision example, we're working with our partner, New Light Technologies, on the impact evaluation of a food intensification program in West Africa using satellite data and computer vision. And since the program was completed years ago without an impact evaluation and without a comparison area, one of the key value adds relative to conventional methods is that we can obtain the data we need on the outcome variables from satellites, and we can retrospectively construct a counterfactual by identifying geospatial areas in the vicinity with comparable attributes. Benefits to policymakers include learning more from what's already been done, in some cases, provided that the intervention is observable from above and can be sort of geospatially bounded. And we can provide more targeting, precise targeting for future programs, with also the possibility of integrating this into ongoing monitoring and planning. Another example, I mentioned causal forests before. We're using causal forests to look more closely at treatment effect heterogeneity in an already conducted impact evaluation of gender norms in India. So the original impact evaluation considered differences in effect size by sex, but also collected a variety of other covariates that might be relevant, including related to religion, caste, socioeconomic status, and others. And relative to conventional approaches, using subgroup analysis or interaction terms, which are typically constrained in sample size in terms of the number of covariates that can be considered, causal forests are a machine learning method that enables robust estimation of conditional average treatment effects, considering the full set of available covariates and representing the importance of each and explaining the heterogeneity of treatment effects. So the natural benefit of this for policymakers is that you can better understand which types of groups and which combinations of attributes are likely to be most or least responsive to the intervention, which can help with program design and targeting, particularly important given the idea of intersectionality, that people have overlapping identities and attributes that can influence their level of privilege or discrimination in society or in their context. In terms of promoting the prudent use of these standards, or of these methods, I say prudent use because there still is a lot of hype, and I mentioned there's different levels of maturity of these, and not a lot of transparency in the existing literature around when these methods are actually better than the conventional approaches. There's a lot of talk about the promise, but not what you should be looking for specifically to determine whether this is going to be better. So that's one of the clear needs, is better documentation around specific use cases and the conditions of when these are most appropriate. Establishing standards of rigor, transparency, and ethics, Definitely the importance of mitigating the limitations of these approaches with mixed methods designs, human in the loop, not just in terms of the analytical process, but in terms of very much agree with the importance of engaging local stakeholders and affected populations to help make sure that the voice is represented and in terms of ground truthing reality. Very important for construct validity as well. In terms of reports, it'd be very helpful if research in this area included practical real-world interpretation of the findings and potential bias. The real-world interpretation is not always clear and bias is not always sufficiently acknowledged. And of course, we need funding and research partnerships to reduce the digital divide so that we don't have a situation in which organizations, research institutions in the global north are sort of just dominating the production of this kind of methodologies. And we have some ongoing efforts that sort of address some of these things within our organization. We're developing hands-on tutorials with code that is modifiable for remote sensing and impact evaluation. That was kind of the lowest hanging fruit, first area we've been focusing on. And we're developing a remote sensing inventory that's mapping social science indicators with their remotely sensed proxies, including a breakdown of like what are the use cases, strengths, limitations, and so forth. We'll be making that publicly available. And we're working on guidance on applications of big data and AI across the program cycle. So along that diagram that you saw earlier, we have a transparency, reproducibility, and ethics initiative that talks about impact evaluation research broadly, but we're integrating big data AI component into it. And we have a partnership with Center for Effective Global Action at UC Berkeley and ULEC Technologies on the Geo4Dev initiative. And I'll stop there. Thank you.
That's great. Thank you. Thank you so much, Douglas. So we're a little tight on time for the panel discussion, but I want to focus the first part of this discussion really on two questions rather than the four questions we had before. And the two questions, the first is this question of, we've seen these new methods, and the question really is, what questions can we answer given these methods that we couldn't have done before? We couldn't answer using existing methods. You know, do we really have to go to the trouble of looking at these new techniques and new data sources? So that's a sort of value-added question. And the second question I'll ask is about uptake. And so there are two sets. There are two sets, at least two groups that we might be interested in this question of uptake for. One is with respect to researchers. What should be done so that researchers engage more with these methods? And the second is with respect to decision makers. What can be done so that these new ideas, new approaches make sense and get adopted? And I guess there's a prior question, which is, are these ready for prime time? So actually, should we be trying to have these updated, taken up by others at the moment? So let's start with the first question. What questions can we answer in principle that we couldn't do before, answer otherwise?
I mean, I think Douglas was just speaking to that a little bit for the methods that he was focusing on. But I guess from our experience with the Point project, the really very new thing was using causal queries to ask much more granular questions about causation for theories where that's appropriate, to talk much more about the balance of causal types rather than aggregate effects. But I think a lot of what came out of our work was that explicit prior elicitation and the use of DAGs can answer the same questions we're already asking more transparently, more replicably, I think. And in terms of what's ready for prime time, I would say in our work, what's ready for prime time is really forcing ourselves to express theories of change as structured causal models. And that rigor is a thing that anyone can do, and we should be doing for various reasons. And what's not ready for prime time is using causal queries, perhaps, but it's absolutely a powerful tool for the right subset of models where taking that granular approach is useful.
Great. Claudia.
Yeah, so maybe just quickly on the Women's Empowerment in Migration Index, I think the big advantage is that it'll provide some quantitative evidence to the what otherwise is largely qualitative evidence that's being used to understand interventions that work. So this quantitative indicator can then be monitored over time. Are there changes? It can also be assessed in relation to different interventions. Of course, is it prime time? It's prime time for additional validation and use. So we've had the single usage following development. We already have some, couple ideas. So it's definitely prime time for application by others. And then obviously we have to bring together evidence, hopefully from a couple of studies. The other point on working with women as women migrants as co-researchers, I think that just tries to get rid of this traditional literature that victimizes women migrants, doesn't give them agency, doesn't give them a voice. I mean, most people who talk about women migrants talk over their heads. I mean, they're almost never involved in in deciding what they want to see, how they want to change their own futures, etc. So I saw there's a question in the Q&A, how expensive are all of these methods? Yeah, so this, is a time-consuming method. It took many Saturdays. That's the only day, and not even every Saturday that women were available to participate in this research. So it's a very time-consuming effort, but I think it changed their livelihoods. The publication I think is very important. And so, yeah, sometimes you can't measure everything in money, but I think that we definitely need to involve, we need to involve the people we talk about and we want to do research about much more into research ourselves. So I think that's a key finding from our work.
Thank you, Claudia. I have a question for you just to follow up, but first of all, just to invite audience members to add in questions they might have now. We'll have a few minutes to address those that haven't been addressed already. Claudia, the question I had for you and Nazmun is, I love the idea of doing this sort of deeper research into the causal processes at work, ex ante, prior to doing an evaluation. I've certainly seen evaluations where the theory just seems to be out of, not in touch with what people are believing is operating, on the ground. But the question for you is there part of your research that then can assess whether those maps are correct in some way, whether they map onto what's have you seen in other data? Yeah.
No, I let Nazmun answer on that because that's was her focus.
Yeah, I think so. And as you can see that one of the identification has been that access to information in terms of migration process and how the intermediaries are manipulating the system. So when we talk to I didn't get a chance to say that, but we actually interviewed the returning migrants and we tried to evaluate whatever the triggers that were associated with their outcomes, whether that is valid with our questionnaire. And we do see that they do mention, not only for the WEMI, but also from the qualitative study, we do see that. And there were emphasis on language training. So even in Bangladesh, government already have some language programs, and based on our findings and our dissemination, some of the NGOs are now thinking about providing language training to women. So there is the dissemination, the point you are making, that how people can uptake. I think we did work really hard to disseminate with the people who are working in the field beyond academia. So I think that has been quite effective for our project. And just to add to why this is important to do, because for many countries in the global south, because the economic triggers or the economic reason dominates the discussion, that's why people should be sent to the country. So when we talk to the women, a lot of them are earning money and they are not empowered. So measuring this empowerment index actually, I think, would be very helpful for the different stakeholders that are engaging in the migration system.
Great. Thank you. Douglas.
Yeah, actually, I have, if it's all right. So answer your question quickly. I touched on a couple of points there. One with the computer vision and remote sensing. What can we get that we haven't been able to get before? You can look retrospectively at programs that did not have an impact evaluation. You can construct a counterfactual. And some other details on that in terms of the types of variables you can look at, scope and scale, and so forth. And then the second point with the treatment effect heterogeneity is you should look at more covariates and look at sort of combinations of attributes. But I had a follow-up question actually related to your question. It's something Matt was saying about the sort of Bayesian analysis and impact evaluation. So I think it's fascinating. So Matt, if you'll humor me, I'm just very curious about sort of thinking about this engagement as a way of talking with stakeholders and eliciting their mental model, the theory of change. How do you structure that in terms of the facilitation? You've got diverse stakeholder groups, different ideas and perspectives. Did you do that with everyone together, individually? You know, how did you integrate then with the sort of expert priors to end up with this DAG?
So in our case, as I say, this kind of early exploratory work, we worked with teams of experts that were made up of evaluators, program designers, and senior members of kind of implementing organizations. And what we did for our first partner team with Upavan, we brought everybody together, and we basically had a group of about 12 people, which reduced to maybe about 9 who were really actively engaged in what was quite a demanding process for them. And we left open the possibility that we would have competing DAGs that came out of that process. But what in the end we got was a consensus DAG that people agreed with. We did that through long 2-hour workshops and some in-between kind of iterative sharing of models and email discussion and sharing of a new model. And I think just to link in with Claudia and Nazmun's presentation and interest, what we'd really love to see is going forward is to use that kind of DAG development process, DAG elicitation, and also the kind of prior elicitation process with actual participants by developing the tools that we developed for prior elicitation with recipients or potential recipients of an intervention. We think that that's possible, that it requires further tool development, but that could be a really powerful way of bringing in more information as well as more perspectives and being an empowering exercise. With our second partner project, we did manage to do some kind of preliminary work with more junior implementation partners who are very much closer to the implementation in the field. And then we took the DAGs generated from that and used them as kind of the starting point for the DAG development with the more senior team. So that sort of tiered approach could be possible, but basically we'd love to see loads more experimentation in the space and lots of people writing up their tools and their learning.
I'll add on too, from what I know, I didn't attend these events, but what I know of them, 2 ways in which the complexity of this really mattered is the set of causal relations between the set of nodes is so vast that in fact the team ended up really eliciting conditional beliefs. So what do you expect would happen under this condition? What would you expect to happen under this condition? And not asking, for example, did this cause this, or is there an interactive effect between this and this, that kind of question. Whereas I think in Claudia Nazmun's project, there's more understanding the causal beliefs. And the second, I don't know how you manage this, Matt and team, but in these sessions, it seems to be a big tendency towards adding many features, many features. And we saw actually in the image that Claudia Nazmun provided an example of that. And arrows from everything to everything. And when things get too large, they're very difficult to use. So that seems to be certainly a complexity and a constraint here. Does anyone else want to come in on these points? If not, we have a whole set of questions that are also raised in the discussion here. One of these I will give to Douglas, which is there's a lot of interest these days in Chat GPT, and so can Chat GPT or improved versions of it be reliably used in this space yet to start, for example, to analyze texts or something else, or are we not there?
Yeah, great question. Something we're talking about a lot as well. I think one of the huge benefits and probably most soon on the horizon applications of ChatGPT and large language models will be just in the sort of exploratory phase of new research. So if you know, now that it's integrated with Bing, once that's available to people, you should be able to connect to the internet as well. The current ChatGPT is not connected to the internet. That would enable people to actually query a particular paper and ask for a brief summary. You could imagine asking for summaries of specific papers in order to inform your background process. In terms of running actual analyses, the risk of things being wrong is very high, but it would sound very plausible. So you wouldn't know, right? You wouldn't know. Yeah. So there's no immediate application unless you'd be doing it sort of alongside your actual analysis as of now. But I know people are asking questions on that. And there's also large language models going. Bloom is an open source large language model. I think is intended more for research purposes. But also so privacy is another issue. You have to make sure that the queries that you're asking of data are not going to be released. And I think that's another important consideration.
Great, good. We're almost out of time. I wanted to point out one thing in the chat. Vic Davies suggests using hierarchical card sort for generating TOCs. There were a number of questions asking about access to the slides or access to further materials. And I would say what I know is that all of these projects have documentation on the CEDIL website, and go visit them. There are multiple papers, design papers, as well as icon papers. And I don't have authority to say this, but if people could add their slides there, that would be a great place so that others can access them fairly easily. Otherwise, beyond that, we're out of time. So just last thing is to thank all the panelists for their insights, participation. Thank you everyone for joining and sending your questions and comments. And I'd encourage you all, if you have more burning questions, to follow up directly with the speakers. Thank you all.